I'll be demonstrating the external jugular vein IV. So indications for EJV are for patients where we are unable to gain access to any peripheral sites, and in patients who are critically unwell, we may need to find large and rapid IV access. So examples of this are things like cardiac arrest. Complications for EJV access include pneumothorax, infiltration of pulmonary tissue, thorax of pleural space, vascular damage, nerve damage, ear embolism, hematoma, and thrombophlebitis. So the equipment we need to complete this procedure is a large bore cannula. Normally you'd be using a 14 to 18 gauge. Just for this example, I'll be using the 20 gauge. So attached to the cannula is my saline flush on the back, and this is to prevent an ear embolism. The other equipment I've got is the lure plug, I've got the flush, I've got an alcohol swipe to keep the site clean, I've got my gauze, my ticodernum, and a sharps box, and this is to keep to ensure safe practice. So when selecting the site that I will be IVing, I will need to gauge the veins, and this can be achieved by laying the patients in a supine position with their head elevated 45 degrees. I can also raise the legs, or we can apply pressure on the liver in order to stimulate the hepatojugular reflex. So the next step is to tamponade the EJV in the supravicular space. So once I've done this, I'm now going to clean the site with my alcohol wipe. So I'm going to do this by using the site that I'm going to be injecting and in large circles. So once I've completed this, I'll need to gain consent from the patient if they are conscious. So I will then make sure that I've had all my saline drug checked by myself and my partner, and I'll be ready to go. So I can use my forefinger and my thumb to occlude and stabilize the vein just above the clavicular, close to the mid-clavicular lines, veins. So I will then remove the cap and tell everyone that sharps are out. And then once I've done that, I can begin to insert the needle. I will be doing this at a 30-degree angle. Once the needle is inserted, I will then aspirate, just to ensure that it is inserted correctly. I will then advance the cannula. Once the cannula has been advanced, I will keep tamponading the vein, remove the sharps out, attach my lure plug, and I will not remove my finger until the lure plug is attached. Once the lure plug is attached, I can remove my finger. I can then flush the vein to ensure it's inserted correctly and there is no infiltration. Once I've done this, I can remove the flush, and then I will secure my vein, my IV, with the ticodernum and some tape. Once the IV is secured, I will then put the date and time of insertion onto the IV, and it is completed.